Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be doing a care plan, and this one's going to be a little bit special because we're going to be focusing on risk diagnoses. So let's get into it. So AL is a 34-year-old female patient with a history of seizures. Her last seizure was 2 months ago. Upon assessment, she is hyperreflexive. So we are thinking of what could potentially happen to this patient, okay? She has the history of seizures, she's had one just in the last 2 months, and she's also hyperreflexive. So you got to be thinking, oh, potentially she could have a seizure. So this is a perfect patient scenario where we can start using risk diagnoses. So a risk diagnosis is risk for, and then it's something else, and then related to the reason why. And as you'll note, normally we have our AEB, our as evidenced by, and that's where we have our proof, our signs and symptoms. With a risk diagnosis, you don't necessarily need to have as evidenced by, because this is a potential thing that could happen. So let's do the first one. Risk for injury related to her neurological disorder. So there's the possibility that she could get hurt if she were to have a seizure. Our goal will be the patient will remain free from injury by the end of the shift. Our intervention, so there's a lot of things you can choose here. The one that I chose was place the patient in a room that is near the nurse's station. And that is part of seizure precautions. That's one of the things that we routinely do if we have a patient who has a potential for having a seizure. So placing them near the nurse's station. And our rationale, a study has shown a decrease in fall rates due to the nurse's ability to check on the patient more frequently and react to call lights more quickly by placing the patient closer to the nurse's station. So she's less likely to get injured if she is in a room closer to the nurse's station because we can get to her quicker and we can check on her more. So let's say we've done that. She didn't have a seizure, so our goal was met. The patient remained free from injury by the end of the shift. Let's do the second one. So another risk. So risk for ineffective airway clearance related to accumulation of secretions during a seizure. So if she were to have a seizure, she is at risk for ineffective airway clearance because of all of the gunk, okay, all of the secretions and stuff that could potentially happen during that seizure. Our goal will have the patient maintain a patent airway at all times during this shift. And then how are we going to meet that goal? Suction the airway as needed. So if she were to have a seizure, we would have suction equipment ready and available and we would suction her airway. The reason we're doing this, in the event of an obstruction, suctioning the airway will remove secretions and help the patient to breathe. So that's pretty simple, right? And let's say, yes, this has happened, we've done it successfully. So our goal was met. The patient was able to maintain a patent airway at all times during the shift. And these things could be because she never had a seizure on our shift, which would be a good thing. Because again, these are risks. These are potential things that could happen. So if they don't happen, then she's not going to get injured and she's not going to have ineffective airway clearance. And that's okay. That's how risk diagnoses work. We're just thinking of what could possibly happen to our patient based on the data that we have. So this one was a little bit different, a little bit specific and special, but I wanted to point it out, and I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.